Hi everybody and welcome to our video series on basics of MSK physical exam. A tiny disclaimer, these videos aim to complement the content seen in class and thus are not meant to replace any didactic material. Nonetheless, enjoy the watch. The wrist evaluation starts with observation. So you can look for skin, swelling, pallor, redness or laceration, muscle bulk, joint swelling, redness, and temperature. So you can look on the dorsal side and the palmar side. Don't forget that most muscles across the wrist come from the forearm. Once you've appreciated the muscle bulk, you can start palpating the muscle to find tensions or zones of tenderness. Finding trigger points and tendon tenderness can give you an idea of what muscle contributes to the patient's condition. Before palpating the carpal bones, you can find the pulses. The radial pulse is easy to find just radially to the flexor digitorum tendons. The ulnar pulse is a bit trickier. You can find it in the Guyon canal or just proximal to the pisiform bone. One of the tricky parts of evaluating the wrist is the carpal bones. So here's a demonstration of how to palpate them on the dorsal side of the hand. So from radial to ulnar, proximally, there's the scaphoid. It's gonna lie in the snuff box. Then right ulnar to it, there's the lunate. And then the third one is the trichotrum. The pisiform is in the proximal row, but lies anteriorly to the trichotrum. For the distal row, from ulnar to radial, the first one is the amate. The next one is the capitate, and it can be found by palpating the third metacarpal. The trapezoid can be found by following the second metacarpal, and then the trapezium is the one that follows the first metacarpal. Active and passive range of motion are usually the next step in the wrist evaluation. As seen here, the evaluator puts a pressure at the end of the extension motion. It is a simple way to get the active and the passive range of motion in one single movement. You can see now the ulnar deviation and the radial deviation. Next comes the rhizome, which stands for resisted isometric muscle contraction or movement. It is a concept that is usually not taught in med school but frequently used by MSK professionals to assess for muscle or tendon injuries as well as their attachment to the bones. The rhizome are done in each direction that is pertinent to the patient's case. As you can see here, the evaluator only applies a pressure that the patient resists in each direction that she wants to evaluate. Each direction corresponds to a specific group of muscles, which can help narrow the differential diagnosis. The last section is composed of tests for some common pathologies, such as the carpal tunnel syndrome. Here is the Tinel test, which assesses the potential compression of the median nerve. It consists of tapping or compressing the nerve at the level of the carpal tunnel for 30 seconds. Reproduction of pain, numbness, or tingling in the hand indicates a positive test. There is also the Fallon's test, which is basically compressing the nerve in the carpal tunnel. Again, reproduction of pain, tingling, or numbness in the hand is suggestive of carpal tunnel syndrome. The same principle can be done for the Guyon canal syndrome. The Tinel test is done on the ulnar nerve when it passes in the Guyon canal. And finally, pain by stretching the snuff box tendons with the Finkelstein test usually confirms a suspected decurvent tenosynovitis. This marks the end of our short video. Feel free to contact us for any suggestions or comments. Thanks for watching.